All right, so the question is whether the general public should be wearing gloves and face masks to protect themselves out in public. So this is in relation to the general public. First of all, COVID-19 does not float and stay suspended very long in the air. The droplet sizes are large enough that once somebody sneezes or coughs, it will fall relatively quickly to the ground. Um, Therefore, the social distancing, 6 feet, is, I think, in my opinion, a very good idea. However, wearing face masks with the general public is, in my opinion, counterproductive and even could be dangerous. Humans touch their face during the typical day an insane amount of times. So when the general public are wearing the face mask, they're often talking, it tends to displace itself, and very often they're readjusting their masks. The thing with COVID-19 is that it does live on different surfaces for quite a long time. Therefore, an infected person that's coughing, that's sneezing, that's touching their face have contaminated hands and therefore will be touching a lot of surfaces. You then arrive, touch a surface, you might get COVID-19 on your hands, but because we have such a tendency to touch our face, that's where the contact and transmission will occur. You touch a soiled surface and then you go touch your face or something, and then you get COVID-19. Kissing somebody who's infected, that will definitely transmit it. If you're close enough where you feel the warmth of their breath, that's enough to give you COVID-19. The other issue is that if you're touching surfaces with a glove, the minute you touch a surface with a glove, there's no difference between having your hands, the skin, and a glove. COVID-19 doesn't, penetrate your skin and enter, through the skin of your hands to infect you. Therefore, even in whether you have gloves or not, you have to assume the minute your gloves or hand touch something that they're infected. You could have tons of COVID-19 on your hands, and as long as you're not touching your face, then you're not going to infect yourself. If you do have gloves or just no gloves, you infect, you touch a soiled surface, now you have it on your hands. If you're going in your pockets, then yes, you're infecting the clothes that you have, and this is called cross-contamination. Therefore, when a healthcare professional is in the hospital treating a patient, whether it's an intubation, giving bronchodilators for the rest distress, or a patient that is on high flow nasal cannula, a patient that is intubated with on a ventilator that's blowing air and that becomes disconnected. The healthcare professional is giving therapies that will aerosolize the droplets, therefore making them a lot smaller, and in that respect, they will float for a longer amount of time. Therefore, the N95s that healthcare professionals are wearing is a necessity. But for the general public, I think that the greatest danger is contaminated surfaces, getting it on your hand. A mask for the general public will have them continually readjusting it, therefore actually, in the long run, putting the virus onto their face. So it might give a false sense of security. The most important, I think, is social distancing, as well as frequent, washing your hands. A 70% and above alcohol solution will denature the COVID-19 after, let's say, 20 to 30 seconds. So you're safe that way. So the most important recommendation, in my opinion, is to always pay attention when the last time you've washed your hands. So go among your business, and touch whatever you have to touch. However, before you come to touch your person, or you having to touch your face for some reason, then you need to wash your hands. That is the greatest defense against contacting COVID during the day and then touching your hands. If you're able, you can disinfect your hands and keep one hand sterile and one hand soiled. So I usually use this as my soiled hand, this as my sterile hand, wash with it and disinfect. I will be doing, touching the grocery cart, picking up materials, always with my left hand. I'll have no wallet, but just my Interac card. And when it comes to paying, my Interac card has already been wiped with alcohol. Therefore, I grab it, I tap, then I can put it back in. And again, I get to my car, the handles, let's say, already disinfected before I left. I'll use the car handle with my right hand and then get in the car and then disinfect my hands. If you must use some kind of facial protection, it's actually more effective then to use a face shield. Therefore, if you sneeze or somebody sneezes on you, then you're actually protected. But the actual face mask, you're going to touch it too much, and I think that it's actually going to increase the chances of infection. I'm not speaking as a healthcare professional, even though I am a healthcare professional, because this is on YouTube. I'm not telling you to go against any of the rules or laws in your area, but for an educational purpose, I wanted to share that. I am a respiratory therapist. I work directly with COVID patients in critical care unit, and I do apply therapies that aerosolize, such as high flow nasal cannulas, intubations, performing intubations. So for the general public, I think that, just repeating myself here, a mask, especially if you have a tendency to reposition it, is a lot more dangerous, because you're literally bringing your soiled hands with a possible COVID-19 virus towards your face. If you must wear something, wear a face shield, keep social distancing, wash your hands before you touch your persons. Thanks a lot, guys.